And just a few more seconds and we'll get started and see people joining, which is fabulous. Happy Thursday to everyone.
Happy almost Friday, only one sleep away.
That's right. And this time next Thursday, we'll be on a public holiday. All right, we might get started. So welcome and thank you for joining us today for the fourth of 4 webinars on an introduction to quality and custom registers, the new modules that were recently released into Practice Hub. Before we get started, in the spirit of reconciliation, Practice Hub acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So once again, thank you for joining us. Today, we have Vanessa Law, our Head of Product here at Practice Hub, and myself, Anna Maria Gibb. Today's webinar is really just giving you a bit of a wrap-up of what we've covered over the last 3 webinars and talking about what's coming next. So a little bit of housekeeping. If you have any questions during the course of the webinar, please use the Q&A function. And a link to the recording for this session and all the previous webinars will be sent out to you shortly after today's webinar. So keep a lookout for those. I think the first 3 webinars had some really terrific information about how to integrate and use effectively the new registers that we've added. All right, so quick overview, as I said, a wrap up of what we've covered so far. Some early learnings from what we've heard from our early adopters, from what those of you who've been using the new registers, even in just the last week or so, what we've found from that. We'll talk about what's coming next with the registers, and we'll talk to you, and also within Practice Hub in general, and we'll let you know how you can let us know what you think. You'll be receiving a survey in the platform. We're going to give you a bit of time to get used to using the product, but we really, really would appreciate your feedback, and we really, really would appreciate you to be very honest in how you're finding it, because that's the best way for us to learn from how you're using it, how you're finding it on a day-to-day basis, and will help guide us with what we do next. All right, so let's have a look at a wrap-up of what we've talked about in the last 3 webinars. So first of all, quite importantly, the way in which you provision and give permissions to the quality registers and the custom registers is different to the way you do it to any of the other modules in Practice Hub. Most importantly, you do not need to go down to admin in the side menu and then go to users and then select each individual user and provision them or set their permissions. So we think that this is a much better process. And again, if you've got feedback for us on that, we'd really love to hear that. We talked to you about quality registers, which are all about recording and managing incidents, feedback and risks. So very much designed to make that process really simple. And Vanessa's got some exciting news on that at the end of the webinar. And from custom registers, we talked to you about all the different ways that you could manage and connect information that you use to run your business. And we had some terrific examples of registers that, that people have created or suggested. So the training register, and I know some organisations are kind of breaking it up into a register for CPD, one for CPR and one for other training. You could do that. You could create one consolidated register, because the really good filtering and sorting functionality that's in those tables will make it very easy for you to sort that information. Things like a key register, you know, when you've got staff and they get a key or they get the fob to open the car park gate and things like that, keeping a register for things like that. We've seen a lot of organisations create things like a medications list or a doctor's bag list. So there's been no end of things that we can see that already people are creating in custom registers. So I think that's probably the main things that we wanted to highlight in the wrap-up. Let me just go through and check my notes. Yes, indeed. So yes, I think that's probably it for where we've been so far, Vanessa. So what are our early learnings?
Thanks, Anna Maria. Following on very nicely from what you have just been talking about, we wanted to share what we're seeing so far for both quality and custom registers. So what we know is that so far, incidents are the most popular ticket type that have been created by you, our customers, followed closely by feedback. Feedback just got pipped at the post by incidents. What we're seeing is that the most selected category for incident tickets is actually incident, but we're also seeing quite a large number of near miss, potential risk, and adverse events being selected. For feedback, complaint is actually the most frequently selected category. However, we're also seeing suggestions and compliments being used. We're looking at custom registers as well. And what we are seeing is that while people are actually taking a look at training and medicine lists, the templates that we provided as part of releasing this new module, we're seeing that people are more likely to create their own custom register, which is great. That is exactly what we wanted to see. It's there for that reason. And so we're seeing a lot more custom registers being created. However, we are still seeing quite a few people use the training and medicine list templates that we've provided. As Anna Maria was just talking about, we're seeing a variety of registers being created, service suppliers, provider numbers, key registers, and that range of training registers. So it's not just a straight training register, it could be broken up into a series of different types of training. So far, the most frequently requested feature, what's coming next, is the ability to upload documents and or link attachments into custom registers. So this is something that isn't available at the moment. It is something that we're exploring, but we don't have any committed timelines or anything for delivering that. So if it is something that you're interested in, or if there's anything else, we strongly recommend that you let us know, because we will be monitoring feedback to decide what do we do next in both of these areas. But overall, it's great to see that people are starting to use both these new modules. From a product perspective at Practice Hub, we look to see how features are adopted. We look to see, are people using it? Are they having problems using it? We don't look at any of the detail. It's purely event-based tracking that we look at. So to say, are people going in and actually having a look at things that are available? So it's a very useful tool for us. It helps us understand how things are being adopted or not being adopted, and it's a great guide. So that's a little bit about what we're seeing for quality and custom registers. And I was lucky enough to be able to share it with the leadership team at Practice Hub earlier this week to let them know, yes, everyone's using it. But moving on to what's next in the bigger picture, we're always busy doing things. We're already starting to work on the next pieces while we roll these out. And in no particular order, there are a couple of key things that we're starting to create the building blocks for, and I wanted to touch on some of these. Tags is a concept that we talked about, particularly for quality registers. It is a new feature that is available. We do believe that tags is an incredibly useful feature and one that we will see rolled out more broadly across Practice Hub as a platform. I think we may have touched on it in the quality register webinar 2, around, wouldn't it be great if you could have a tag that was accreditation and you could use that same tag, be it in quality registers, custom registers, documents, pages in the manual, tasks, anything like that. The ability to be able to quickly and easily group and then find information is really the goal. That's really the problem we're looking to solve with tags there. So we'll be doing more in that space in the near to short-term future. Settings is another piece that we have been working on. So if you have gone in and taken a look at settings from the side menu, if you've gone in to look at how do you configure quality registers, if you wanted to make changes to locations or any of the categories, you may notice that there are a few other tabs in there that you may not be familiar with. particularly the first tab that you land on, you'll see that we've actually got some settings in there that we haven't openly talked to anyone about. We haven't said, hey, go and take a look at this. The sorts of settings that you'll see in there are things like which industry standards do you align with? You'll see information about, do you go through accreditation? And if you do, what is your accreditation cycle? And when's your next accreditation date? These are all building blocks for us for future features that we're looking to make available in Practice Hub. So, for example, why do we want to know whether you're accredited, and why do we want to know what your accreditation date is? We actually want to have a little widget on the dashboard that lets you and everyone else within your organisation know when your upcoming accreditation is. We will then look to use that to give you reminders and hints and tips in the lead up to your accreditation date. So that's one of the reasons why we've included that setting there, and look out for future updates from us where we say, hey, you can start to populate this and this is what you'll be able to do with it. Industry standards is another one. The reason that we're looking to capture that sort of information is to provide more relevant content to you, be it through Content Library or through the sorts of messages that we send through the message board capability. So letting you know that you will see some features in that setting. We encourage you, go and take a look. Absolutely. There's no reason why you can't go and look. You can certainly set anything you like there, but if you're wondering why you can't see it, it's because, as I said, these are the building blocks for upcoming initiatives that we're working on. Permissions, business and user roles. I'll kind of group these together. We've started to introduce a different way of looking at permissions and a different way of assigning permissions in both quality and custom registers. And we will be doing a lot more work in this space. What we'll start to do is change the way that you manage users and assign permissions today. So I'm sure that you're all familiar with go to admin users. You then open up a particular user, you will provision particular modules or applications within Practice Hub on or off. We know that today we only support one type of business role, so a user can only belong to one business role. And in the future, and this is something that we are actively working on right now, we will actually start to extend that out. So we'll offer support for multiple business roles. We will likely change the name to user roles, so it is far more applicable. And all of this is to do with how do we actually improve that experience for managing users? How do we give you more control over the sorts of permissions that you want to be able to assign to either individual users or a group of users that belong to a particular role? So look out for more work in this space. And last but not least is staff management. It's a very broad topic. It is one that is very near and dear to our hearts. For any of you that are on this webinar, if you attended the AAPM pre-conference workshop last year, we actually talked a little bit about this. We know that this is an area that healthcare organisations in particular are looking for assistance with. We believe that we can do a lot in this space, and it is the next big thing that we will be working on from a Practice Hub perspective. The pieces that you see above, like tags, settings, permissions, business and user roles, they are all important features and building blocks to help us move forward with staff management. And even custom registers, we know that those are things we're looking to see what sort of things actually belong as part of a staff management or a HR module, as opposed to sitting within a custom register. So I encourage anyone that's on this webinar, if you are interested, if you are prepared, if you're happy to share some of the pain points that you have with staff management today, we'll definitely be reaching out and asking, what are the key problems? What can we do to help as part of the discovery work that we're doing in this space? So that's a lot. Lots of little bits and pieces we'll do along the way as well, but those are probably the key things to call out. And again, I reiterate, I encourage you to try quality registers and custom registers, try tags, see how they work for you. We don't want to go ahead and build anything else if we don't think that it's going to be useful to you. So Adama has already said that. We encourage you to let us know, yes, this is great, or no, this isn't so good for me. Last but not least, I think, Anna Maria, we really want to touch on, I guess, maximising the value of Practice Hub. And so I'll hand back to you for just a moment.
Thank you. Yeah, I thought while we've got an audience, a captive audience almost here, it would be good just to remind you of some of the things that that we see regularly in people's Practice Hub sites, where I think with just a little bit of action or a reminder of what's the purpose of these things, you can get more value. It can be more of a, an assistant in running the practice. So probably a couple of things I wanted to flag at this stage. And Vanessa, you might drive the mouse around the board.
Absolutely.
The first one I would like to highlight is the notifications bell up the top. So if you see a little red dot up there, that means that there's stuff that has been dropped in there. Either it could be things that you have updated, but otherwise what you'll see in there is when we've sent you a message. So you can see there we sent a message introducing the custom and quality registers. So that sort of notifications panel can be really useful. Keep an eye on that. If you see the red dot, go and have a look. You will see, again, if you go back to the dashboard, other things under that red dot. So in the case of the quality registers, is we updated the resources where we sent the release notes. And I think if you scroll even further down, you'll see in the content library, we updated some of the policies and procedures. So those were updated to align with how you use the quality registers. So we're saving you having to rewrite your policies to reflect that. We've kind of done most of that for you. So notifications is a really, really good way of keeping track of what we're providing to you within the platform itself. The next thing is what you're seeing on the screen, which is the dashboard. I know a lot of times people are like, oh, I'm a bit overwhelmed by everything on the dashboard, but I would say work through those things. Don't let them get out of hand. Some of the things that we see is around maybe too frequently setting expiry dates or review dates for policies and procedures. So be realistic about what you're going to do in that area. So some policies might need to be reviewed every year. Maybe some can push out to 3 years. More than 3 years is probably not good business practice. But definitely, have a think about that. Same goes with compliance. Really think about it's read, understood, and agreed to comply with. So if it's FYI type of information, maybe it doesn't need compliance. So again, sort of, thinking through that. But certainly the dashboard is a really good way to keep track of what needs to be done for both you and for the team there. And again, gives you an easy way to follow up with your team. I personally love the recently viewed because I did find that, you often are going back to the same pages over and over again or the same sections. So that can be quite a quick way of finding information. The other thing to highlight is probably if in the content library. So Vanessa, if you just pop over to the content library, one of the key things here I would recommend is look down the release date. So in the notifications, you will see when we release new things into Content Library, but you can see there the second category down had a release date of the 8th of April. So that is relatively new stuff. So that's a really good way of checking and seeing what's been most recently updated. Do I need to go and adopt any of that? At the very least, you can find it easily and go and review it. So having a look at the release dates of information in the content library is quite a good way of finding out quickly what's been changed that you might want to go through. The other thing, I guess, we're coming up towards into the month of May, and those of you with nursing staff, you'll know that their AHPRA registrations need to be renewed by the end of May. Definitely go into the AHPRA Alerts application, check the registration list, make sure your nurses are all listed. If they're not, it probably means, or it does mean, that their AHPRA number has not been added to their user profile. And again, if you make good use of that, it means that you're going to get alerts about when they've renewed their registration, or more importantly, if they've forgotten. So it's a really good way to make sure that you're maximising the benefit of that particular module and saving that manual process of have you renewed, can you show me the evidence, etc., or going online onto the AHPRA site. This will help you, this will save you having to do that. And probably the only other main one, I know a lot of people like the equipment register. So I would suggest don't forget to make sure that your key equipment is listed in the register, along with key things like the maintenance dates as well. So I always say to people, equipment that is that you need to show evidence of maintenance, calibration, whatever, for accreditation should be in there. Your high value items should be in there, and then anything else you want to put in. So sometimes you look around and you think, oh my God, where do I begin? That's the kind of prioritization I would use. Things that you need to show evidence, things that are high value, and then anything else you want to go to from there. So I think just those few things, keeping an eye on the notifications, keeping an eye on the dashboard alerts, checking release dates in Content Library, making sure your AHPRA registered people are in the showing up in the AHPRA registration list, and keeping your equipment register up to date with the key pieces of equipment. Some of the things that if you were doing those, you'd find that Practice Hub would be adding quite a lot of value to your processes. Thanks, Vanessa.
Thanks, Anna Maria. Just going to go back into this. And I am very excited for those of you that have been on some of the earlier webinars, or if you've had a chance to look at the release notes for quality registers. We did mention that we are actively working on what we call the QR code feature. QR code is really about the ability to be able to create tickets anywhere, anytime, whether you're in Practice Hub or not. It could be used by staff members. You may actually choose to have QR codes up in your organisation, in your physical locations, really to help capture particularly incidents at the point at which they may occur. So if people have got a phone on them, they can scan a QR code. They're presented with a simple form. They can submit that form. It automatically drops into Practice Hub as a new ticket in quality registers that you can then review. Similar to scanning a QR code, you could also save the URL as a bookmark. So if you do have people that are not frequent users or not actually users of Practice Hub, they might be your clinical staff, you could easily bookmark the URL link, and instead of them completing likely something on a piece of paper, when an incident occurs and they need to share it with you, we suggest that they actually use the URL, click on the link, complete the form. They don't need to be in Practice Hub. They don't even need to be a Practice Hub user, really to save time and improve efficiencies for you, so you can easily capture that. We are in the final stages of testing. I'm pleased to say we're at the testing phase for QR codes. It will be available in the next couple of weeks. You will see it. We will announce it, as Anna Maria said. We'll post messages up. We will probably do another little product tour as soon as we make that available to you. It is completely your choice whether you use it or not, but it is here and it is working. So if anyone has a phone handy, Anna Maria, I'll ask you to do it.
Yeah, sure.
You can scan the QR code. You can see what the form looks like. Please note this is a test environment that I am using. I'll leave it up for another minute or so. Let me know when you're finished, Anna Maria.
Sure, you're all going to love this one. Okay. Yes. Okie doke. I got my thank you message. So what did we get?
Excellent. All right. Let me flip across here. As I mentioned, this is a test environment. Please ignore the data that you are seeing on screen. But as you can see, we've been doing lots of testing with QR codes. I'm going to refresh the screen. Need more refreshments. Anna Maria, was that your
That was me.
ticket? Okay. So we can see here, just by scanning that QR code, and as I said, if you'll also be able to save the URL link, it's the same process. Automatically, a ticket has been created. You must have selected feedback, or it's defaulted to feedback for you. Completed the form. Fingers crossed that this works. We need coffee and biscuits, and this information is here. So there's no double handling. There's no, oh, I've received an email or something. I've got a piece of paper from someone. It could be, I know that we mentioned earlier that, for patients that are in your waiting rooms, if you want to encourage them to provide feedback, whether it's a compliment or a complaint or a suggestion, they can easily scan the QR code and it will automatically come in and appear in quality registers for you. So I'll close that for a moment. The ability to create the QR code, as I said, it is completely up to you whether you choose to use it. There is another button that will be appearing once we make this available. The link is here. You simply click download QR code. It will appear. You can save and print that. You can copy this URL. Easily copy it to your clipboard, save it as a favorite, and away you go. So the ability to actually access the Create QR code will be restricted to people that have an administrator role. It's not something that we want people to have access to all the time. We've also included the ability to reset the QR code. So if for some reason you wanted to change the URL or change the QR code, it's the same thing. You can easily and quickly just regenerate another QR code and away you go. So looking forward to that being out and available to you in the next few weeks.
I think, Vanessa, too, I can see us, in practices, they can print that code and put some wording around it, for patients, we value your feedback, scan this code, something like that will make it really terrific. And also, again, for those of you, particularly in general practice, getting accredited, it's a good way of demonstrating how you collect feedback beyond just the once every 3 years survey, but to that ongoing feedback that you're collecting over time.
I think that brings us to a close for today's session and for this webinar series. Anna Maria mentioned earlier, we will be asking you to complete a survey. If you can please complete it, let us know if this has been beneficial or not. We really appreciate the time that you have taken, your lunch breaks, probably spending it with us over 4 sessions. It's been great.
It has. Thank you to everyone. We look forward to hearing your feedback on this, on the new registers, and even the things that Vanessa has told us about today. Thank you. We've had some really happy feedback, haven't we?
We have. Have we had any questions?
We didn't get any questions. We got a thank you message. So
Lovely.
Thank you. We appreciate that. The registers are going to be awesome. Thank you. We certainly hope so. And as we said, particularly with custom registers, we're absolutely fascinated to see what type of registers people go ahead and create. So that will be very informative. All right. So on that note, I think we might let everyone go. Thank you again for your time. And we look forward to catching up with you next time.
Thanks, everyone.